My name is Major General Dr. Shri Pal, Vishisht Seva Medal, retired. I am from a company, Bunkerman. I have come here on the invitation by Voice of Healthcare. This is an organization which is arranging this National Stroke Conclave and Awards here in Hotel Hyatt, New Delhi. In this Stroke Conclave, most of the delegates and speakers are highly qualified doctors who are specialists in stroke treatment. Stroke is a brain attack type of thing. It happens when any patient is under tension, hypertension, or he is feeling the lack of oxygen in the blood. Now, as you see, the environment in Delhi outside is highly polluted, but indoor environment is 3 to 4 times more polluted than outside air. So under such conditions, we have got the solution, Bunkerman Technology, which is being given to civil population for the first time. Here we give the required indoor air quality to the hospitals, to the patients in their homes, etc. So I have discussed with many doctors here since morning, and they agree with our view that the patients of stroke need due care in a good indoor environment before treatment, during treatment, and even after treatment, called rehabilitation period for the stroke patients. This particular technology, Bunkerman technology, is very good, because what this technology does, that firstly it controls the carbon dioxide level in environment. Carbon dioxide level for a patient as per Indian Standard Code is permitted not more than 500 parts per million. But nowadays in Delhi, the CO2 content in normal air is recorded as 600, even 700 parts per million. So if same air is being given to the patients, then as it is as per Indian Standards Codes of Practice, it is health hazard for a patient if we give him any breathing air which is containing more than 500 parts per million of carbon dioxide. So our Bunkerman indoor air quality management system, once the CO2 content in indoor air goes beyond 800 parts per million, it starts filtering automatically, and you can set the limit of carbon dioxide level. For a patient, it can be set even below 500, like 400 ppm is the minimum limit, and maximum you can set as 500 per ppm if there is a stroke patient. So you can set the reading between 300 and 500 parts per million. So patient will get the breathing air as per the Indian standards. Also, if the patient is okay, then you can slightly increase this. But even for normal person staying indoor, the quality, the maximum limit of CO2 has been specified as 800 parts per million to 1000 parts per million by ASHRAE. So also, if you have to stay in button-up period, like in isolation period during Corona, patients had to stay in isolation period, in isolation care. So in this case also, we provide the conditions of indoor air quality in button-up mode. You can specify what level of oxygen is required by the patient, what level of carbon dioxide is required, and how much positive pressure is required in the isolation ward. This can be specified, and our computerized system takes care of this. This Bunkerman indoor air quality management system ensures that in any room of the patients are given the breathing air as per laid down standards. The oxygen content in that room will be as per the limits laid down by the users. The oxygen level will not decrease below 19.5 or 20%, or as laid down by the doctors. Similarly, carbon dioxide level in breathing air should not exceed more than 500 parts per million as per Indian standards. So this limit can be set by the doctors below 500 parts per million, and with this system, if installed in a patient's room, then patients will be getting the breathing air which is good for his health. And if you keep the patients in such room with the facility of Bunkerman indoor air quality management systems, then there will be less possibility of the patients suffering from the stroke in that room. Even in case of any emergency, the facility has been provided in this indoor air quality management system of Bunkerman to provide breathing air or oxygen to a patient as shown in this particular picture. Two patients can be provided the medical oxygen simultaneously with the help of oxygen mask, which is provided on either side of this Bunkerman indoor air quality management system. With this, the facility of providing oxygen will be available next to the bed of a patient, whether he is in a home or he is in hospital. Thank you.